UNAIDS Regional Director for Asia and Pacific, Mr. Murphy. The remarks as well from the CEO for Thailand and Medicare, and as well as the remarks from the Deputy High Commissioner. Before we invite His Excellency, the Speaker of the House, Dr. Medicare. So just before we begin, saya kita sangat cukup untuk sebagai Muslim ini mana untuk orang orang di kampung, mereka tu menuntut kini solat. Thank you so much for being here this afternoon. The Minister of Health and Medical Services is a privilege to have you this afternoon, considering the busy schedule. So we also acknowledge your unwavering support in making strong efforts in addressing the support to the HIV in Fiji. A warm welcome as well to our Honorable Minister of Health and Chief Guest for the Minister of Health and Medical Services, Dr. Thank you, sir, for always valuing the partnership from donors and always be available and required. With that, we would like to welcome all the distinguished that are present here this afternoon to witness another great support to the program. The UNAIDS Regional Director, Asia and the Pacific, the Deputy High Commissioner, Mr. Paul Wilson, the UNAIDS Country Director, Ms. Patra, Ms. Renata Ram, the UNAIDS Country Director, Fiji and the Pacific, CEO Atlanta Medicare Company Limited, and the senior executives of the government, the ministries and necessary representatives, and the media and community present here together. Now, only for taking your valuable time out and gracing this occasion, reflecting the assistance to the Ministry of Health and the whole government as opposed towards the support for the HIV program. Your presence here today speaks for the support. And without any further ado, it's my great pleasure to call upon the Honorable Minister for his keynote address.
Yes, the Speaker of Parliament, the Excellency the Minister of Australia, Fiji, Mr. Paul Wilson, the Atlanta Medicare Company Limited CEO, Mr. Super Amidst, the UNAIDS Director for Asia and Pacific, Mr. Murphy, the UNAIDS Country Director Thailand, Mr. Janatapun, the UNAIDS Country Director Fiji and the Pacific, Mr. Ram, our partners in health and friends, senior officials in the Ministry of Health. Ladies and gentlemen, thank you for this invitation. Thank you for being here. This important virtual face-to-face event for the Ministry, in particular for the services we provide for people living with HIV/AIDS in Fiji. Today's event marks the coming together of effort, dedication, commitment, and passion of many partners, organizations, and individuals who overcome many challenges we face in delivering health services to our people, among which is the COVID-19 pandemic. The pandemic, which is in its 19th month globally, has challenged the ability of health services to around the world to deliver the normal hospice. In Fiji, this includes our program to care for those with chronic diseases such as HIV/AIDS, as well as scale. But as we continue and as the days go on, we learn more and more how to adapt our practice and services better to the new normal of doing things, and we are slowly improving, escalating our response on the programs that were effective to its full capacity. For HIV/AIDS, since 1999, we've had significant developments, both locally and internationally. 15 years later, we can say that HIV is no longer a death sentence, and people can live normal lives after being diagnosed with HIV. While HIV does not have a vaccine yet, invented, we have life-saving treatment available. The governments may commit to provide free medications to people living with HIV for more than 20 now. In 2020, we had 157 cases, and 84 in the Central East Region, 49 in the West, and 14 in the Northern Division. With 13 children, 90% of them usual for effective pregnancy with HIV was transmitted from mother to child. And as of December 2020, cumulatively 1,266 people have been diagnosed with HIV since 1959. This keeps the prevalence at 0.14%, and 73% of them, the majority of them, is 30% of thousands. Past 2 years, there's been an increase in the number of MSM transgender cases who have been diagnosed with HIV, as one of the strategies to scale up testing in priority populations. Of the cumulative cases in Fiji, 78% of these individuals are on this life-changing HIV treatment. While we have the Fiji HIV Act, there's been a need to review and upgrade the necessary policies and strategies and guidelines, bearing in mind the scientific updates that are readily available. Recently, Fiji has reviewed and updated the following critical guiding documents which are in line with WHO recommendations. They are the Prevention of Parent Child Transmission of HIV Syphilis Policy, the HIV Care and ART Management Guidelines, the Influenza Vitamin Treatment Guidelines, and the Comprehensive Management of STIs Guidelines. The Ministry of Health and Medical Services is working with our UN partners to support processes in place for the procurement of HIV testing capacity to ensure that it's sustainable. During this pandemic, or we are battling with the pandemic, we ensure that we sustain the normative functions for people with chronic disease, including the perfect people living with HIV/AIDS, by establishing 10 medicines for consultation, removing patients to be clinics open for patients who require face-to-face services, and most importantly, providing vaccination for positive patients at the vaccination sites. Several people with HIV also diagnosed with COVID-19, supported, and have fully recovered. The advancement of treatment and undetectable viral load has brought success in better life quality to individuals living with HIV. Fiji recorded one death of an HIV patient who was diagnosed with COVID-19, and this death was not due to the disease but died with the disease. We are currently in the process of looking at strengthening our strategic guidance and policies to further strengthen our HIV program through collaboration for community testing by partnering with government and non-governmental organizations across Fiji. We want to strengthen the capacity of our health workers to diagnose and treat healthcare workers, and review and adopt Fiji's HIV testing, counseling strategies and policies. We want to upscale Fiji's preventative programs, such as the condom program that knows one status of HIV, and for the people living with HIV for which say the risk individuals, as I'm alluded to earlier, on the life-changing HIV vaccines. Looking at the second wave of COVID-19 in Fiji, with the new flights and availability of HIV treatment, the was assisted and the coordination between UNAIDS, DFAT, and Ministry of Health and Medical Services for this much-needed HIV medicines to the ministry. UNAIDS was able to secure a donation of $570,000 worth of first-line antiretroviral drugs from the Medicare. They also UNAIDS contributed $67,000 Fijian dollars for every cost to this donation. With that, for the donation of pediatric HIV drugs and freight purchased from Thailand, amounting to just over 10,000 Fijian dollars, and also we sincerely are appreciative of the support of our partners. In fact, that the Fijian government is committed to supporting the HIV program for all Fijians. And today we come and also like really thank His Excellency the Speaker of the House of Representatives of Fiji for his enormous role as a champion for HIV AIDS, not only in Fiji, but in the Pacific, all around the world. Now, sir.
Services. So we now have the second keynote address by the UNAIDS Regional Director for Asia and the Pacific, Mr. Murphy. I think he's actually online, so we probably need to turn around this case.
Good afternoon from good morning from Bangkok. Good afternoon, Fiji. Bula. Honourable Minister for Health and Medical Services, Dr. Walker, The Honourable Speaker of the House and our UNAIDS Goodwill Ambassador for the Pacific, His Excellency Ratu Apele. It's great to be with both of you this afternoon, along with the Deputy High Commissioner to Fiji from Australia, His Excellency Paul Wilson, the Chief Executive Officer of Atlantic Medicare here in Thailand, Kun Supayadev, and his colleagues. My colleagues, Kun Patra, who's the Country Director for UNAIDS in Thailand, and Renata Ram, who's the Country Director for Fiji and the Pacific. It's a great honor to be with you for the event today to mark the formal donation of the antiretroviral medicines, first-line ARVs and pediatric HIV regimens to the government of Fiji on behalf of its people. Let me thank both Atlantic Medicare of Thailand and the Australian government for their great support to the people of Fiji at the outset. UNAIDS is committed to ensuring that during this COVID pandemic, HIV services remain uninterrupted. The pandemic risks reversing hard-won gains made in the HIV response in many countries across the world, including in Asia and the Pacific. We've seen significant declines in prevention services and new treatment access. The support of this donation demonstrates the importance of ARV treatment in achieving the global target to ending AIDS as a public health threat by 2030, but more importantly for the people and the communities of Fiji. In Fiji, there has been a 97% increase in new HIV infections since 2010, a 158% increase in AIDS-related deaths. In the Asia-Pacific region, Fiji is among the top 5 countries with rising new infections among the 15 to 24-year-olds. This is a new wave of epidemic across our region in a number of countries. In Fiji, it's a 50% increase. This is an alarming trend and a significant concern, especially in the current context of the intersecting pandemics of HIV and COVID. It's one of the most challenging moments in the history of the HIV response, because the great risks of setting back the progress that's been made in so many countries, which is why the importance of reform of national responses, including in Fiji. This supply of first-line ARV drugs and the pediatric medicines has been a collaboration between Asia and the Pacific. Amidst these unprecedented disruptions caused by COVID, the country offices in Fiji and Thailand mobilized the efforts in their countries, work together with Atlanta Medicare, which is a private sector firm. And that's an important thing to remember, private sector stepping up to support the people in another country. And the Australian Department of Foreign Affairs and Trade through the High Commission in Fiji, to ensure that the continuation of life-saving ARVs to more than 500 people, including more than 40 children in Fiji. For us in UNAIDS, geography plays no restriction on our area of support, and it's each of our staff members' utmost priority that every person living with HIV has access to the ARVs and the life-saving medicines. COVID-19 has seen many cross-country collaborations within the program in order to support ARV, because people have been stranded in other countries without access to their normal medicines, including Fijian citizens. And this has been an important part of the collaboration of our offices across the region, in addition to ensuring supply that is uninterrupted by international flights or transport challenges. The supply would not have been made possible without an effective partnership. The Sustainable Development Goal number 17, which is partnerships for all the goals, clearly is demonstrated through the undertaking between both the private sector of Atlanta Medicare here in Thailand and the Australian Ministry of Foreign Affairs and Trade. This is important not just for HIV, but in ensuring that all access to health services is maintained whilst the world is battling with the COVID-19 pandemic. The impact of the 6-month disruption of antiretroviral therapy could have set the clock back in Fiji to as far back as 2008 in terms of AIDS-related deaths, as well as seeing a significant potential increase of new HIV incidents. So the donation itself is critical and very much appreciated, as the Minister has said. When treatment is adhered to, a person's HIV viral load drops to an undetectable level, keeping that person both personally healthy, providing support to their families and their communities, and it also prevents the onward sexual transmission of the virus. When a person is unable to take their treatment regularly, the viral load increases. It impacts on the person's health. It can lead to drug resistance, as we see very high levels of drug resistance in Papua New Guinea, a neighbor of Fiji, and it also leads to negative impacts on people's health and the potential of early death. UNAIDS would like to applaud the hardworking HIV program staff based in Suva, Lautoka and Labasa in the HIV hub centers who have ensured that ARV treatment has been supplied to their clients through innovative approaches of multi-month dispensing and postal deliveries during the time of this COVID pandemic. They are frontline response staff as part of the Ministry of Health. This solidarity and shared responsibility are needed now more than ever to mitigate the impact of COVID and build pandemic resilience. UNAIDS will continue to support the Fijian government in its efforts to fulfill its commitments to the 2021 HIV political declaration recently signed in New York and the 2011 Fiji HIV law. We welcome Fiji's dedication to HIV in providing free prevention, testing, and HIV treatment for every Fijian that needs it. As we all know, inequalities are the driving force behind both HIV infections, AIDS-related deaths, and COVID-19. So to end AIDS, we need to end inequalities, and therefore partnerships like we have here today with this donation are critical between the private sector, between the government, between the community, between other governments such as the Australian government, in working together, not just for the health of one country, but for the health and safety of citizens across the region. Thank you very much for your time, and it's a great pleasure to be with you today. I'm sorry that I can't be there with you in person, Ratu Apele. It would be great to spend some more time discussing the merits of rugby between our countries. So I hand the floor back to you, to the MC. Thank you very much.
When we implement Medicare company that into their online as well. Everybody can compare with us and get
Hello. Good morning. Good morning, everyone. I am very pleased and honored to meet all of you and the Dr. Iferani, the Minister of the Health, Fiji, and all of you from the UNAIDS. On behalf of Atlanta Medicare company, I have to thank you for every invite us to join you today in this handover ARVs medicines ceremony to Fiji. I am very honored to be a part of the supporting UNAIDS Fiji, Thailand, and the regional Asia Pacific to provide the antiretroviral medicine for treating people living HIV during the impact of the COVID-19 in Fiji. We know that the COVID-19 is a serious disease that is set to hit the countries with the highest burden of HIV very soon. Everyone, including people living HIV, should take the recommended precaution to reduce exposure to and prevent infection by the virus that causes COVID-19. Despite the scale up of HIV treatment in the recent years. There are many people living with HIV do not have access to the antiretroviral therapy, which may compromise their immune system. We believe healthcare is a universal need and should be accessible to everyone. HIV is a global menace, and the same is in Thailand and Fiji. Thailand, with its universal coverage for of the ARVs, has managed to control the newer case. And with the same focus strategy, we hope the Fiji government is also achieving the control of HIV AIDS in Fiji. We appreciate the mission of UNAIDS to lead the global effort to end AIDS as a public health threat by 2030. As part of the Sustainable Development Goal, we wish Fiji best which on the third Sustainable Development Goal to end the epidemic of HIV/AIDS by 2030. Okay, thank you very much, everyone.
The taking over address by the UNAIDS Commissioner, Mr. Paul Wilson.
I start by thanking you for the generous invitation to the Australian High Commission to be here today for this important ceremony. And I present my apologies to for the behalf of High Commissioner Fix, who was unable to be here. We're very honoured to be here today. We are very, very pleased. The Australian government is very, very pleased to play its part to support this generous and important donation to Fiji. I think today is a reminder that while we have all been focused so closely on COVID-19, and that focus remains, and that focus is vital. Today's a reminder that some problems are new, some problems are not. Some issues that we have to continue to manage, address, and criticization of their aids. And I know today has drawn very useful focus on those Fijians and those in the Pacific who continue to suffer. But it also, I have will draw focus on the Fijians, those other frontlines. We emphasize the COVID-19 frontlines, the HIV and AIDS frontlines, who continue their work to support Fijians, HIV positive and suffering from AIDS. Australia is very, very pleased to be part of this donation. We are a long-term supporter of Fiji, just as we have worked very closely with Fiji Health and Minister of in particular, supporting the COVID response. Our support for this donation underlines not only our long-term support, but also the depth and the breadth of the support that we get. But I think more importantly is that this event underlines, and you see that with the Minister of Health representatives from UNAIDS, representatives from Medicare, that this is an act of partners, governments, multilateral organisations, and also a private sector, which is a great thing. So very pleased to be part of this, and once again, very grateful for the invitation to be here to represent Australia. So to the Minister, Excellency, Speaker, our friends from UNAIDS, everyone here. Thank you very much.
Thank you, sir. We'll invite His Excellency, the Speaker of the House, and the preliminary to go to the keynote.
The Minister for Health and Medical Services, Dr. Ifrahim Wangari, the UNAIDS Regional Director for Asia Pacific, Mr. Iman Murphy, who you saw earlier on, and is here with us in spirit. The Deputy Australian High Commissioner, Mr. Paul Wilson, the CEO, Atlanta Medicare Company Limited, Mr. Sup Adeji, Noor Sakur, the UNAIDS Country Director, Thailand, Ms. Pachara Benjaratnapon, the UNAIDS Country Director, Fiji and the Pacific, Ms. Renata Brown, the staff of the Ministry of Health and Medical Services, members of the media, ladies and gentlemen. Good afternoon. Isam Burvinaka, Salam Alaikum, Namaste. I am indeed very proud to be here this afternoon to witness this handover of ARV medication to the Ministry of Health and Medical Services. This year has been like no other for Fiji. And despite it all, we can proudly stand together to affirm the continuation of our HIV response. The COVID-19 pandemic is threatening the progress that the world has made in health and development over the past 20 years, including the gains we have made against HIV. As a lifelong supporter of ending AIDS and as the UNAIDS Goodwill Ambassador for the Pacific region, I am greatly confident that the donation of these antiretroviral medications will be a most welcome lifeline to the 506 people living with HIV in Fiji, who, without this treatment, would certainly have had a high chance of succumbing to AIDS-related deaths. This includes 38 children who are currently on this treatment. I would like to thank our friends from UNAIDS based here in Fiji and Thailand for their leadership in mobilizing the support needed to ensure that the HIV drugs arrived in Fiji without any disruptions in treatment. This is especially so during this time when logistics have been an issue for procurement. Thank you, and Vinakabagalero to Atlanta Medicare from Thailand for this very kind donation of first-line HIV drugs. And to our Huvale partner, DFAD, for supporting the pediatric HIV medication. According to Global AIDS Monitoring Report, Fiji is shown as being included in the top 5 countries of rising new HIV infections in the Asia-Pacific region. Among the 15 to 24 age group, and with an increasing rate of over 50% since 2010. Now, this puts Fiji ahead of all other Pacific Island countries and is thus a cause for great concern. Our Fiji statistics show that during the past 3 years, we have seen an increase in HIV cases among men who have sex with men and transgender persons. In 2020, Fiji had a total of 147 new cases, and 13 of these cases were pediatric cases. These were mostly opportunistic cases, meaning that there was an active outreach done for testing. This could indicate that there are many unknown cases out there, a trend that is common throughout the world. I have no doubt that you will agree with me that these numbers are not acceptable. As I have often said, we must never take our eyes off the ball. Unfortunately, we appear to have been somewhat complacent in Fiji when it comes to HIV. I fully understand and totally support the importance of the COVID-19 response and the prominence it has now been given, and the calling for full and concerted public action to combat it. However, I also believe that existing diseases such as the pandemic, HIV/AIDS, also needs our continued attention, as it has been around for so many years and is still without a cure, and as such has lifelong impacts on people who are affected and their families, immediate and extended families. The COVID-19 pandemic must not be an excuse to divert investment from HIV. There is a risk that the hard-earned gains of the AIDS response will be sacrificed to fight against COVID-19. But the right to health, which is very prominent in Section 38 of the Fiji Constitution, means that no one disease should be fought at the expense of the other. Ladies and gentlemen, like all epidemics, it is widening the inequalities and faults in our systems that already exist. However, the HIV response in Fiji was not at its best even before the COVID-19 pandemic. But the collision of COVID-19 and HIV has set it back further. COVID-19 is a wake-up call for the world to strengthen health systems and make it more meaningful. Had health systems and society safety nets been stronger the world over, we would have all been better positioned to slow the virus and withstand its impacts. Ladies and gentlemen, I believe that the lessons learned from the HIV response and all the resources that have been injected into our health system in Fiji since our hard-hit second wave of COVID-19 has given us the boost we need to rejuvenate our HIV program. It's not too late for us to reduce the number of new infections of HIV in Fiji and prevent AIDS-related deaths. There are many innovations that we in Fiji must introduce. This includes PrEP services for HIV prevention, stronger HIV combination programs, targeting young people and key populations such as the LGBTIQ community and sex workers. We also need to learn from the best practices from the Asian and African regions on community-based service for expanding our reach. And together, we can end AIDS by 2030, which has been the target all along. At times, we have wavered and we come back. We wavered again and we come back again. We need to keep coming back, make sure we stay on top of AIDS. It's been with us now for too long. I look forward at some future days to the reconvening of the HIV board meeting, where we can discuss this new way of working on our HIV programs with the UNAIDS Pacific Office, our bilateral partners, civil service, and the hardworking Fiji HIV team, and all the other workers who have worked on HIV/AIDS, the quite unknown ones, doing hard work all the time, every day, and are unknown. I look forward to that occasion at some time in the near future. All I want to say now is good to see you all. Thank you. Shukran.
For those wonderful and encouraging words, we invite Dr. Tashika for the beginning of the.
On behalf of Fiji the Fiji Ministry of Health and Medical Services, firstly, I would like to thank the Honorable Speaker of the House, His Excellency Ratna Therikau, our Goodwill Ambassador for HIV in the Pacific. I would also like to thank our Honorable Minister for Health and Medical Services for taking out his time and joining us today for this very important program. I would also like to thank our Deputy High Commissioner from Australia, His Excellency Mr. Paul Wilson, also for taking out your time, and also for all the support that DPEC has provided Fiji, especially with the pediatric formulations that have been brought into the country, which is life-saving for our patients. I would also like to thank our UNAIDS Regional Director for the Asia and the Pacific, Mr. Eamon Murphy, also our Country Director in Fiji, Ms. Renata Ram, and UNAIDS Country Director for Thailand, Ms. Pachara. Thank you very much, UNAIDS, for all the support that you have provided in enabling all these antiretroviral to come into the country, enabling with all the shipment and all the nitty-gritty assistance that you have provided the country. A big Vinapabakalat who goes to Atlanta Medicare for a huge donation, life-saving donation to the country. I would personally like to thank you as a HIV clinician. I know how important these drugs are. So on behalf of all the 3 HIV clinicians, clinics in the country and the positive community, I would like to really thank Atlanta Medicare and DFED for their support that they have provided and UNAIDS for making this possible for us. I would also like to thank all the arrangements and all the assistance that our FPDS personnel have and made this possible today for us. For me, HIV program has been something that has been very personal and very close to my heart because I've worked in this field for so many years. So I know how much game changer these medications are going to be for our patients and how much our patients are going to really appreciate this drug. So thank you very much. Thank you.
Before we proceed with the questions, we'll just invite Mr. Ramrao just to bless the president with the word of prayer.
Almighty God, our Heavenly Father, we are so thankful this afternoon for everything you provided. Thank you for the wonderful program, and thank you, Lord, for all the good hearts that have spread the love for the nation of Fiji. Thank you, Lord, for the refreshment before us. Pray for cleansing, pray for blessing, and to partake of it. They are going to be nourished and continue to be your will.
I need to take a photo shoot at the nations on the other side before we give time to the media.